So here is the next presentation is by Rajeev Raman, and he has given me this slide, and I'll share in short what has been done by Rajeev Raman. This is very good work of Dr. Rajeev, and yeah, can we move on the slide? So basically, the difference what AI can do in diabetic retinopathy is there is some repetitive tasks which he says that if doctors are not having much time, so they can identify, AI can identify. But there are some things which doctors cannot do, and that is prediction and of the disease. So AI can do screening. It can diagnose stages of PDR and can also classify OCT abnormalities. But the thing which is new, which has come out, is predicting about the disease progression. Also, response to the treatment, which can be predicted. And that is what he has worked on. So, as of now, according to him, it is a screening tool and also helps in prediction of response of the treatment. So what are the screening guidelines using AI and how predictive, how good the algorithms are? So as the American Diabetic Association says, that artificial intelligence can be used as a predictive tool and the benefits can be used. But where AI is not to be used is if the patient is a known case of diabetic retinopathy, if there is a prior treatment, or if there is visual impairment. That's the article which I was referring, and what point he has made here is that it is empirical for ophthalmologists to grade all the identified referable photographs of AI by human beings in India, because 10% of normal are also referred. So that is the consensus criteria about AI. What is the accuracy of algorithms? And he compiled 10 articles which have used various criteria, like various grading criterias, and they have come out with various sensitivities and specificities, which range from, say, 50% to nearly 92%. And what he says that they are reasonably good. So this is the current status of various algorithms. And how SN is using, so there is an assisted mode where an eye doctor is given photograph, for example, an anterior segment specialist, or it can be done where the doctor has no knowledge about diabetic retinopathy and he has been given photographs and AI is assisted. And this is the video which shows how the work is done there, EMR based. A consent is taken, and then ultimately through the record a photograph is presented, and that photograph is being examined, and after examining, the classification is done by AI. And then also a doctor gives his opinion. For example, here it is mentioning a stage, and AI is mentioning a stage. So either what AI as of now can do in diabetic, so diabetic macular edema can be either handled by human resource, which is manual learning, or it can be used through machine learning. Whereas the additional thing which is coming out is predicting the responses of disease. So here the thing is he is using OCT to predict whether the response will be there or will not be there of a particular patient. And this is the sequence of event that EMR से question generate करते हैं, फिर उसके बाद data को analyze करते हैं, then optometrist validate करता है, then there is some other questions asked, and ultimately OCT is done and the data is generated. So a huge data is processed into a small data, and then there are certain criteria which are used for diabetic retinopathy, and then it goes to machine learning, and then a prediction is generated. This is quite interesting, that as the disease progression goes on, the regression becomes more linear. So that means what AI is predicting and what human beings are predicting, they are going hand in hand. That is what I could interpret out of this slide. This is quite difficult slide actually to interpret. It is somebody else's work. The other thing is, other good thing which has come out of this study is using biomarkers and then predicting a score, making a score of diabetic retinopathy, and then using that score as a criteria for prediction of the outcome. For example, the inflammatory biomarkers have been used. For example, thickness, cystic degeneration, hyperreflective things, whether they are involving the center or they are not involving the center, whether they are involving the outer layers or the inner layers, a classification is generated, and that classification has been given a color, and you can have an overview of your severity by just looking at the scale. And then ultimately a score is generated. This sounds pretty good, and I think a lot of energy must have been given, and what I interpreted out of this slide is that gives you a pretty good accuracy and precision. And this is a small video where he is trying to show how this is actually a self-explanatory thing where AI is actually identifying that these are the features, and then ultimately a score is generated, and out of this score so these are the criteria for hard exudates, intraretinal cyst, microaneurysm, cystoid macular edema, and an inflammation score of 65 is generated, and which predicts that severity is very high and this may not respond to anti-VEGF. So that is one interesting outcome of this particular entire big exercise. Sounds pretty interesting. So what is the take-home message? That it is a diabetic retinopathy is a screening tool. Simultaneously, we can screen other angiopathies, and ultimately it can be used as a predicting tool for outcomes. And that is what is the chart of evolution. So I thank Dr. Raman for sharing his slides.